We are one day out, one day after the procedure. We did a fat grafting, a facelift, and a hand fat transfer. And how are you doing this morning?
Couldn't be better.
Very
under
good.
the circumstances. Great.
Okay, well that's our first shot.
This is a test, honey. How you feeling?
Okay, I'm back home from seeing Dr. Lamb. I think the pain was a little worse this morning, but that meant I went longer without the pain medication. But after I took that, I feel pretty good. Actually, it's kind of hard to keep myself down. I guess not turning my head is pretty hard to keep reminding myself, but I'm trying to be a good girl and keep lights on.
Okay, well,
That's all for now.
over and out.
Okay,
Today is Sunday, August 10th at about 7 o'clock, and I'll turn the microphone over to the loving future ex-beautiful patient.
Yeah, today's day 2. I think I felt really good yesterday. Probably did more than I should have, but I got a good night's sleep last night and I've rested all day today. Just finished cleaning everything, and I'm probably going to call and see if I can come in and have Dr. Lamb, one of your assistants, do some real good cleaning behind the ears. I couldn't see to do a very good job and didn't want to turn my head too much. So I will be calling you in the morning, and I'll probably see you sometime tomorrow afternoon, whenever it's a good time for you. And Jim will bring me because I don't want to turn my head to drive. So I'm going to sign off for now and go back to the bed.
Over and out. Okay, Mary, do you want to look at me? Do you want to say something and to say hi to the doctor and tell him that you think everything went okay, Mary?
And you're touching. Hi.
This is Tuesday, approximately 7 o'clock, and here's the patient.
I'm back again. Today is, my surgery was Friday, so I've been recovering Saturday, Sunday, Monday, and today. The swelling, as anticipated, has moved down to the lower part of my face. Most all the bruising is gone up around my eyes, which was very bruised on the right side. A couple of things that I'd like to enlighten any of you that are anticipating having this type of surgery done was, number one, the first thing when I came home on Friday evening after the surgery, my head was bound very tightly with bandages, and then I had this wrap, which I continued to wear and will for several more days, actually probably up to the maximum of about 2 weeks most of the time. I could not get my mouth open enough to brush my teeth, and that was very frustrating because I had a bad taste in my mouth. And my husband suggested the little brushes that he uses sometimes to go between his teeth, which are very tiny. And so I was able to put a little bit of toothpaste on there and get it in my mouth and work it around like this and clean my mouth up and rinse pretty good, getting water through a straw like that. And my mouth felt a whole lot better. And then yesterday, for the first time, I was able to get the smaller of my sonic toothbrushes. We have 2 sizes and one is small. I was able to get that in when I did not have this bandage on. I just had the very loose bandage on and could open my mouth a lot more, which I'm doing today. As you probably notice, I'm talking better and brushing my teeth good, and took a shower, and I've been cleaning my incisions. And Dr. Lamb I went in today. He told me I could come in anytime to make sure I was cleaning them thoroughly, all the way around the ears, because I couldn't see the back, and I was concerned maybe I wasn't cleaning them good enough, but he said I did a great job. And so he gave me some more Q-tips and the bastration to use, and told me I could have washed my hair. I didn't, because another bit of advice I would like to share is I think you should wash your hair and have it thoroughly washed with no spray or anything other than maybe a tiny bit of conditioner on there when you go in, so your hair is completely clean. I did not wash my hair the day before, and I had some hairspray on it, and I have sort of stiff stuff, if you can see right here. And I was afraid to put water on my head because I thought maybe the hairspray rinsing off might get into the sutures. and that might not be good. So Dr. Lamb said it would have been fine to go ahead and wash it, but I held off, and so I'm going to wash my hair tonight with cool to very lukewarm water and just a soft spray, and sit on my little teak bench. And my husband's nodding his head because like all women, I guess I talk too much. But I guess that's an indication I'm feeling better too. So this is day 4 for me, signing off.
Over and out. All right, this is Friday night about 5:30, and the patient is with her favorite chocolate lab. And I'll turn the program over to the patient.
Hi, I'm Jonna. Today is 7. So I was feeling pretty bad this time last week. My surgery was last Friday. Today's Friday. Tremendous amount of difference just in the last 2 days. A lot more energy, less pain. You can see a lot of the swelling has gone down. Today's the first day I've put on any little makeup concealer a couple of places, and I saw Dr. Lamb today, and he said I'm healing beautifully, and he did his little famous laser tricks on some of these darker bruises, so they should be yellow in 3 days and gone shortly after that. So I guess from now on it's just a matter of the swelling going down, and probably 6 months is what he told me when the final results, but after 2 weeks, nobody but me will know I'm a little bit swollen. So it was totally painless. He took the sutures out, the ones in front of the ear that had to be cut out, and then the others will just disintegrate, and took the stitches out under my chin and just put some stereo strips on. And altogether, I'd say it's been, I won't say pleasant, but it's been a very easy experience, and Dr. Lamb is, I trust him completely, and so therefore I'd recommend anybody that thinks they need a lower neck lift and want to look younger in every way to let him give you his opinion. Actually, he noticed I didn't even know that my right earlobe was larger than my left and kind of misshapen. And I do get ear infections here because when I had my ear pierced, they pierced it down instead of straight. And so sometimes when I'm putting hooks in, I have a hard time getting it to go over the right angle to go down, and I tend to get ear infections over there. So and I hadn't even noticed that, but he did, and he straightened that up. And a couple old scars, he did his magic zigzag stitching, so they'll even be less noticeable than the others were, and they weren't even noticeable. Nobody ever mentioned it to me. Anyway, so I think this is super after 1 week, and I'll check back in a couple of 3 days and let you see how I'm doing.